Hi, I'm Dr. Faisel Syed. Welcome to another episode of Faisel and Friends. We're here because we believe everyone deserves access to quality primary care, and ChenMed needs physicians to take care of them. Today's topic is housing security in healthcare. My co-host and moderator of the chat, Dr. Dan McCarter. Dr. Dan, welcome.
Hey, Faisal, it's good to be with you again.
It's good to be back. After this 4th of July weekend, I hope you had a safe one.
Absolutely. Absolutely. I didn't venture nearly as far away from home as you did, though.
Yes, this is true. I'm very excited about this topic that we have tonight. My Our friend joining us is Jason Shaplen. Jason, welcome.
Hey, Faisal. Hey, Dr. Dan. Happy to be with you.
I am so excited to hear about some of your innovative ideas around housing. I remember I knew early on that I wanted to work with the underserved. I remember, but I didn't know what that would all entail. I didn't realize all the limitations in the system, how few are the encounters that we would have on an annual basis per patient, and when you think about what impacts health the most out of with transportation issues, even with food, loneliness. I mean, housing. If people don't have access to basic housing, and like in the community health center world, I mean, if you have 2 visits per patient per year, you're doing pretty good. and so when you see a patient and you're spending such few precious minutes with each of them, and meanwhile they're struggling with something as basic as housing, whatever we can offer, you can only offer so much. And so I'd love to get started with tonight's episode. Basically, Jason, if you can let us know how you got involved with deeply affordable housing, and I'd like to talk about the relationship with housing and health.
Sure. Well, how I got involved with deeply affordable housing was honestly quite by accident. Like you, most of my career has been in public service, and I decided I wanted to get into the business of running companies from the ground up, but started to build a network and ended up consulting for people in the homeless field and working with a large homeless organization in New York. And lo and behold, 20 years later, was still doing that and building housing. But like many things, I want to say I just fell into it, much in the same way that people actually fall into homelessness. So 20 years later, here I am, still working in homelessness and housing and healthcare.
Wow. You know, with when we're talking about trying to improve health, not looking at a person's home, like a living situation, is quite, it's quite irresponsible. I mean, from a medical point of view. I mean, I can maybe prescribe a medication or prescribe a treatment, but if a patient, yeah, if a patient doesn't have a safe place to go home to eat a meal, I mean, how can you really make a lasting impact to their health? I mean, we wonder why half of medical care is delivered in the emergency room setting. Almost half, at least pre-COVID. Pre-COVID, half of medical care was delivered in the emergency room setting. I mean, this is one of the reasons why.
You're absolutely right. And we all talk about social determinants of health. And we know in healthcare that 60 to 80% of health outcomes actually have nothing to do with what we do in the four walls of our health center.
Yeah.
It happens outside the health center. And housing as a determinant, and the housing unstable is probably the biggest, more than almost any other determinant. Housing is the foundation that's required to advance not just economic mobility and well-being across generations and things like that, but health and physical and mental health. You cannot get to healthcare without housing. They are inextricably linked, and that's why the title of your show tonight is so relevant. Housing security in healthcare. You cannot get to healthcare and health outcomes without housing. So they are tied. And when you look at some of the numbers with, inside there, it gets even a little more frightening. I'm happy to do that if you want.
I would love to get into some of the real numbers with poverty as well as with near poverty. I know oftentimes many people are shocked when they hear about our healthcare delivery system in general, especially with the numbers of like how the large percentage of people that get their medical care from the emergency room setting. I think I think that this would be a good time to get into some of the reality with the numbers when we're talking about poverty in the United States today.
Okay, so this is where you're asking me to nerd out, and I'll be a nerd for a second on this. But here's a whole bunch of statistics, which I think you're right, though. I think, Faisel, it really tells a story that people have a glimpse of, but don't understand, and they really don't know the extent and the impact of it. So let me put it this way. I'll set a whole bunch of context and drill down. But if you look at in the 45 years since LBJ's start of the war on poverty and 2019, we'll take the pre-COVID period. During that period, during those 45 years, the US experienced growth in real GDP. The economy grew in all but 7 of those 45 years. And in 5 of those 7 years, it contracted by less than 0.5%. So not by much. Really only a couple of years where we had the economy contracting, everything else was growth. And you think those statistics would evoke envy, and they do evoke envy. They tell a story on one level of economic success and stability.
Sure.
But they're also totally misrepresentative. They are offset by additional data that tell a much more sobering story of inequity and exclusion and injustice. And so, listen to some of the following, if you will. Despite that near half century of growth, in 2019, and I'm going to use the 2019, not 2020, because we had, COVID came through in 2020 and that changed these numbers typically for the worse. I'm going to go with the numbers before COVID. Despite that half century of huge growth, and the economy grew on average by 3.7% a year during that entire period. Despite all of that, in 2019, using something called the supplemental measure of poverty, which is a more accurate measure, 38 million people, 11.7% of the country lived in poverty. And that number is sort of known, is sort of out there. What's not known is that they were joined by another 46 million people who lived within 50% of the poverty line, and what's known as what you just called near poverty. That's 84 million people who live in poverty or within 50% of the poverty line and near poverty. And I want to put that, let me put that in context because it's really important. Tonight, you, Dr. Dan, and I all are going home and having dinner. We're not even going to think twice about it. These people, these 84 million people will. They're going to go home and they're going to ask themselves, do I put dinner on the table or do I pay my rent? Do I pay my rent or do I buy my asthma medication? I can't do both. And unfortunately, the story even gets worse from there. Those two groups that I just talked about, those 84 million, they're joined by another 42 million people who live between 150% and 200% of the poverty line. The number that we in community health centers use, 200% of the poverty line is a number that we know well. So when you look at those numbers, it blows the mind that after half a century of economic growth, more than 125 million people, just shy of 40% of people in the country, either live in poverty or within 100% of the poverty line, where they struggle daily to provide for them those basic needs. And of course, Blacks and Latinx are disproportionately impacted. The numbers are, the numbers experiencing poverty are twice the rate of whites. And why that 125 million people, 40% number is really so important is they're the housing unstable. And we just talked about what happens when you're housing unstable. It ripples through everything. Economic mobility, health, but also actually education, safety, employability.
Sure.
Without housing, these and other basic needs are severely impacted, if not unachievable. So those numbers, even when I tell them to you now, they sort of blow my mind. And these were pre-COVID numbers, Faisel.